tried, the worse it got, and we just went round in a circle. But I recognized quite early on in the day that the day wasn't happening. And I emailed a lot of my colleagues and just said, look, today I'm really not doing very well. I'm going to need to cancel the meetings and I'll check in with you later. And all of my colleagues were fantastic about it. Actually, my students were also fantastic about it. And so I guess I would just encourage you to recognize that actually lots of people are struggling. One of the colleagues that I emailed to say, you know, I can't do today, he replied and said, I know exactly how you're feeling. I'm normally doing absolutely fine, but I had a panic attack yesterday, and I'm finding this all hard. So I wouldn't be surprised if you share with others that actually you need a bit more time and you need a bit more space and you're finding this difficult, that actually you get a message back that says, me too, this is hard. I think often we don't want to share our fragility and to share how hard we're finding things. And I would encourage you to think, well, actually that reluctance to share that creates this sense that everyone's doing okay, that we're all managing all right. And having the confidence to put your hand up and say, actually, I'm not doing so great right now, I'm finding this difficult. That gives other people the window of opportunity to say, me too, I'm finding this hard, I'm finding it challenging. So in sharing with others that you need more space or more support or more help or more time, you're giving them that window to do the same as well. I think it's important, if we're thinking about the distinction between anxiety and depression that might be caused by this situation, and actually recognizing that you have a substantive mental health problem, that we don't jump into an assumption that this is now a mental health problem. I don't want to undermine anyone's experiences, but I want to say that actually it would be really strange if you weren't struggling right now. It's totally expected that you're going to be finding the time difficult right now. I wanted to pick up perhaps some ideas and suggestions for working from home and managing your own mental health in a lockdown environment, and really picking up on some of the points that Hendrik raised about how you manage if you are stuck at home. My work with Student Minds, and I've put a link up there for you. Student Minds is the UK student mental health charity, has focused primarily around peer support and what we can do to look after ourselves. So this is just thinking about steps that we can do for self-care. One of the things that happens if we spend a large amount of time at home is all semblance of routine can disintegrate. So we don't get those cues to say, well, now's the time to leave the house, now's the time to do our commute. If we're not in an office, we're not getting that reminder that actually perhaps now's the time to have a walk, a break, time to have a chat with somebody, now's time to have lunch because that's when the canteen's open, time to go home. Our lives are all sort of merged into this sort of soup of work-life confusion. And so my key suggestion is to try and do what you can to build a sense of routine into your daily lives. So thinking about having fixed times about getting up and fixed times to start work, having a fixed time for meals. In building that routine, you reduce the number of choices that you're having to make, which makes it easier to sustain motivation and to keep going when things are challenging. So if we can reduce the pressure on ourselves to have to make decisions about what do I do now, when do I do this, that just frees up a bit more cognitive space for you to be thinking about other things, and just makes it easier to keep running through the day. So having a routine to reduce choices that you're making. And the things that I think about the routine, I think Desiree's already mentioned this about sleep, having fixed times to sleep, but factoring in time to unwind, that you're giving yourself an opportunity at the end of the day to unwind. Some of my colleagues, I'm feeling at the moment is are really running at 110 miles an hour. There's a bit of a feeling that because we're at home, we should be able to be super productive, and that's just not realistic. Desiree was saying so many different things that are sort of creating cognitive challenges for us, but are going to be making us less productive anyway. But on top of that, I think actually working from home, you can be less productive because without a routine, you really need a lot of effort to push yourself, to motivate yourself to sit down and get on with work. And I think one of the best ways to try and be more productive is to reduce your expectations and give yourself smaller chunks of time to work, and more chunks of time to unwind, to do things that you enjoy, factoring in time for that, so that you're creating that balance for yourself. By having more time to unwind and more time to do things that you enjoy, it makes it easier to be productive and motivated when you come back and sit at your desk and try and get on with some work. I wanted to pick up some suggestions around simple things that you can do to look after your well-being. I'm sure many of you will be familiar with the 5 ways to well-being. These are to give, to connect, to notice, to learn, and to keep active. And we know that if you can engage in those 5 ways to well-being, that they can help you look after your mental well-being. So I'd encourage you to have a look at those, to have a think about creative ways that you could engage in them. We also know that it's easier to engage in them and sustain your engagement in ways to well-being if they have some meaning and purpose for you. And I kind of want to pick up on Hendrik's suggestion here that actually being in this state of lockdown, we have a huge opportunity to have perhaps a bit more time to reflect and to think. I know that's not true for everybody. I know a lot of people are balancing childcare. I have a 15-month-old toddler at home with me, so my additional time is limited. But for those of you that have time, I try and really think of it as a blessing. There's an opportunity there to reflect and think about what gives you meaning and purpose in your life. And that was why one of the links I've been sharing, and I know people have been having a few problems to access it, is the Positive Psychology Center at the University of Pennsylvania, at UPenn, which is led by Martin Seligman. Martin's website there has lots of resources about how to identify meaning in your life, to support you to reflect and think about positive approaches to think about life and goals, advice and suggestions about engaging with ways to well-being. So I'd suggest that you want to have a look at that, and that there's lots of resources there to help you think and reflect at the moment. The last point I wanted to just pick up was around peer support. I've been pitched a question about how would we detect signs of depression in ourselves and our colleagues. And I really appreciate the suggestions that have been given so far by our previous speakers about reaching out and being proactive, about asking and thinking about how to start those conversations. I would encourage, I guess I'd like to encourage all of you to think about what you can be doing, not just for your own mental health, but for your peers. Our mental health is so, I guess, entwined and enwrapped within our community and our society. So if we want to make a mental health better amongst our community, we need to take those first proactive steps to think about what can I do for my peers, how can I support others, as well as how can I look after myself. And I would stress that however isolated that you're feeling at the moment, or distant to other people in your community, other people in your university and your university needs you right now. Your peers need you right now. Everyone needs to know that they are connected, that people care about how they're feeling and how they're doing. So there are really simple things that I'd encourage you to do, which should just be to stay in touch, to reach out, to check in with people. A big sign that someone's struggling is distance and isolation. So not hearing from a friend or a peer would be an indication perhaps that they're struggling a bit more. And just really simply reaching out, a text message, how are you doing? Do you have time to chat? Can we set up a FaceTime, a Zoom to have a conversation? We'd love to hear how things are going. We have in England, I don't know how universal this is, but in England, a terrible habit of asking people, are you okay? Or how are you doing? And it's a throwaway question and we don't really expect an answer to it. So I would encourage you at the moment to ask twice. So if you're checking in, how's someone doing? Don't just ask how are you, how are things going, but ask it twice. When they answer, yeah, it's fine, ask again, how are things really going? How are you really doing? It gives people that prompt, that nudge to elaborate and perhaps share if they are struggling. I think on that note, I'm gonna stop. I think a lot of the other points that I wanted to raise have really been brought up already, and I'm really keen to think about the questions that people might have. So thank you.
Thanks so much, Nicola. That was great. Yeah, I really like your point about the fact that it would be really strange right now if we don't feel like we are struggling or finding it difficult. And I like your phrase, work-life confusion, in comparison to a work-life balance, which often gets thrown around a lot. And yeah, thinking about our peers, I think, yeah, that's, to me, that's really, really something salient for me. And that, yeah, there's even lots of studies showing that if you help others, it can actually make you feel better, it activates your reward system. And so, you know, it's, even though it's, you can see it selfish or unselfish, but, you know, everyone wins in that situation. So yeah, I think what we'll do, we'll move on to our discussion section now. And I just want to thank all the speakers first for all their great insights and their contributions. So if I could ask all the speakers to put their cameras on. And what I'll do, we have a lot of questions actually, which is great. We've got 25 questions in total, which we definitely won't get through for now, but what we'll try to do is answer some of the questions that we don't manage today, either in a future webinar or maybe through social media, or maybe we could even ask the speakers if they have time at some point, if they could help contribute to the questions as well. So what I'm going to do actually to try to be as democratic as possible, I'm just going to go through the questions according to the number of votes that people have put in. So the first one, so if I could just present it to the speakers, and maybe, because we don't have too much time left, I was wondering if we could maybe just have one of the speakers deal with one question. And then, yeah, we'll try to get through as many as possible. So right now it's actually, we were planning on finishing at 12 noon, which is only 10-15 minutes away. So I just wanted to ask everyone first, would you be okay to go, if we go till 12:15, would that be okay? Yeah, great.
I have to bow out at 12, sorry.
Okay, that's totally fine.
Regrettably, my husband and I are tag teaming important work calls, and it's,
Sure.
and
Our times are all limited right now, so
sorry.
we totally understand. It's all good. Okay, so we'll just go with the first question. And the person asked how to deal with the feeling that I don't get enough done. A lot of people feel tired after 3 weeks. Yeah, if anyone could tackle that one.